Pulmonary Disease. I'm really excited about this one. I think it'll be a really good one. You guys will learn a lot. So this question on my community page on YouTube led to this video. You can see the respiratory disease one, so that is where this video is coming from. Alrighty, this is the book that I use for reference. Our scenario is a 49-year-old female presents to the ED with an abrasion on her hand from a knife injury while she was cooking lunch. Her health history includes a 22 years history of cigarette smoking, dyspepsia, chronic obstructive pulmonary disease, and a cholecystectomy last year. So question 1. She provides a list of home medications. Fill in the missing blanks using the options below. So I'll give you 20 seconds to answer the question, so you can pause, skip ahead, whatever you'd like to do, and then we'll go through the answers after we go through the questions. So question 2, so still going through the scenario, the nurse initial assessment of findings include, and then select the following findings below that require follow-up by the nurse. Feel free to pause the video if you would like more time. Question 3. The nurse knows that smoking has many health effects and that it causes defects in multiple areas of the respiratory system. She has a nursing student with her, and the student is wondering the long-term effects of smoking on the respiratory tract. Which of the following findings below is a long-term effect of smoking? A. Bronchospasm and hoarseness. B. Decreased mucus secretion and cough. C. Increased function of alveolar macrophages. D. Increased risk of infection and hyperplasia of mucus glands. Question 4. You and the respiratory therapist provided education to the client about smoking cessation options. In addition to smoking cessation, what treatment is included for COPD to slow the progression of the disease? A. Use of bronchodilator drugs. B. Use of inhaled corticosteroids. C. Lung volume reduction strategy. And D. Prevention of respiratory tract infections. So indicate which actions on the far left column are appropriate for each potential complication. Note that not all actions will be used. So here on the left you have your nursing actions. You have 9 options. Your potential complications are on the right here, so just go through each potential complication and then select the appropriate nursing action for each complication. What breathing technique should the nurse teach the patient with moderate COPD to promote exhalation? A. Huff coughing. B. Thoracic breathing. C. Pursed lip breathing. Or D. Diaphragmatic breathing. Question 7. The patient receives albuterol while in the hospital. She asks, what does albuterol do? What is the best response by the nurse? A. It reduces chest congestion. B. It reduces bronchoconstriction. C. It reduces acid reflux. And D. It decreases inflammation in the respiratory tract. Alrighty, now we'll head on to the answers. So question number 1. So looking at each of the medications here, for guaifenesin, we know the dose is 200 milligrams orally every 4 hours. It is a mucolytic agent, and the drug action is to reduce that chest congestion. For tiotropium, it's a hard one to say, so 18 micrograms as a dry powder inhalation once daily. It's an anticholinergic drug, and this helps to maintain the relief of a bronchospasm. For montelukast sodium, 10 milligrams tablet orally once daily. This is a leukotriene modifier, and it reduces bronchoconstriction and inflammation. So this question, we're selecting which assessment findings you would follow up with as a nurse. So starting at the top here, labored breathing. So labored breathing is defined as abnormal respirations that reflect increased work of breathing. So labored breathing may look like the use of accessory muscles, taking rapid, shallow breaths, nasal flaring, grunting, or abnormal breath sounds such as stridor or wheezing. So this would definitely require follow-up because it would show that the patient is not breathing as effectively and having an increased work of breathing. Denies headache, that's good, that's normal, so we don't need to follow up on that. Oxygen saturation, 88% on room air. So they do want you to follow up for 88% on room air and maybe put some oxygen on. Unable to read the admission paperwork without glasses. Although this is maybe something we'd want to follow up with eventually, it's not really a priority at the time. Pupils equal, round, and reactive to light. That is a good sign. So our arterial blood gas. So our pH is 7.37. Normal pH is 7.35 to 7.45, so that is normal. PaCO2 is 48, so slightly elevated. Usually we want it around 35 to 45, but our pH is in PaO2 is 81. That is okay. And then HCO3 is 21, and that is also okay. Leaning forward with hands on upper thighs. So this is called an orthopnic position, and it reflects that labored breathing again, that difficulty breathing. So that's something we'd want to follow up on. Chest symmetrically rises with each breath. That is a good thing. What do you guys think would happen if the chest is not rising symmetrically? If one side is rising more than the other, that would indicate a potential pneumo. So definitely something we'd want to follow up with. So the fact that the chest is symmetrically rising is good. Respirations of 26 a minute. This is elevated. Normal respirations are 10 to 20. And respirations of 26 a minute reflects that respiratory distress and is another cue of a COPD exacerbation. Denies fever and chills. That's a really good sign, meaning hopefully we're not thinking about sepsis yet. Blood pressure 125 over 57, that is fine for an adult, and heart rate of 95 per minute, that is also fine, normal for an adult. So, question 3. So which of the following findings below is a long-term effect of smoking? So the answer is increased risk of infection and hyperplasia of the mucus glands. This is one of the long-term effects of smoking. Other long-term effects of smoking include like cancer, chronic cough, chronic bronchitis, and COPD. When I took this question, I chose bronchospasm and hoarseness, and bronchospasm and hoarseness are acute effects of smoking. So the key here is, what are the long-term effects of smoking? Question 4. Which treatment is included for COPD to slow the progression of the disease? So prevention of respiratory tract infections is really important. Infections just make the disease worse, so definitely wanting to prevent that. And the other options listed here help to manage the symptoms of the disease. Question 5. So we'll go through each here. So starting with respiratory infection, the correct answer here is to teach the client to drink at least 2 liters of fluid daily. Patients with COPD are at increased risk for respiratory infections due to the pulmonary inflammation that leads to that thick and sticky mucus. So this results, that mucus buildup results in more bronchospasms. Hydration helps to thin the secretions so the client can expectorate them and get the mucus out. For dysrhythmias, the correct answer is to evaluate lab results for acid, base, and electrolyte imbalances. This nursing action helps to prevent dysrhythmias. The other option that you may have chose was number 7, to implement continuous cardiac monitoring. This is also something the nurse would want to do, but it's not the best answer because it's not going to prevent the dysrhythmias. The implementing continuous cardiac monitoring will allow us to recognize dysrhythmias, but it won't allow us to treat it. So that is why they want the lab results, so we can gather the labs, figure out what's incorrect, and prevent dysrhythmias. The activity intolerance, correct answer is number 8. Encourage self-care, encourage the client to pace what they're doing, and then also implement periods of rest. For oral candidiasis, you want to rinse your mouth after administering corticosteroid inhalants. So this is really important for clients, any clients who are taking corticosteroid inhalants. So, for example, patients with asthma who are taking these, or for COPD, just have them rinse their mouth after the medication. For hypoxia, you'll want to administer oxygen therapy. For malnutrition, it is important to provide 5 small meals a day. This also helps with fatigue and increasing their nutrition with the small balanced meals throughout the day. For anxiety, you want to help the client develop a plan for what she should do when the symptoms occur to help maintain control over the episodes and decrease her anxiety. Question 6. What breathing technique should the nurse teach the patient with moderate COPD to promote exhalation? The nurse would want to teach pursed lip breathing. So pursed lip breathing prolongs exhalation and prevents the bronchioles from collapsing and prevents that air trapping. So that is the most effective for a patient with COPD. The other options here, I'll go through them. So huff coughing is a breathing technique that involves increasing coughing to remove secretions. It's almost like you breathe in and then you cough out. Thoracic and diaphragmatic breathing are not as effective as in patients with COPD, and they actually may increase their work of breathing and dyspnea. So we do not want to recommend those. Question 7, the patient receives albuterol while in the hospital. She asks, what does albuterol do? What is the best response by the nurse? So it reduces bronchoconstriction, reduces that constriction in the bronchioles, and helps with easier breathing. Here's my reference list. Thank you guys so much for watching. Please subscribe and follow along for more videos on studying for the next generation NCLEX. Have a great day, you guys.